So this is going to be video 2 for walking, and we're going to talk about walk-in clinics and extended after-hour clinics. These things might not be common elsewhere I'm not sure about the rest of the country or other countries, if you have walk-in clinics or after-hour clinics. So we'll be talking a little bit about that. So what is a walk-in clinic? Walk-in clinics usually require no appointments. All you need is a health card. You walk in and then you talk to the person at the front desk and usually reserve a spot that way by giving them your health card. Some clinics also have a number system where you go up and you see a little ticket. You grab the ticket, it has a number, and when it's time for you to come up, then you give them your health card. The ticket system is more popular in busier clinics or places that they expect to be very busy at specific times or dates. So that's what a walk-in clinic, how it kind of functions. And so a walk-in clinic, you go there for like sick notes or needing healthcare help the day of, but you can't get to a family doctor, and your condition isn't like severe enough to immediately go to the emergency room, basically. So that's what a walk-in clinic is for. Like, for example, if you got a small cut at while you were just running around outside, and depending on how many people they're seeing, the wait time varies. It can be a few minutes to a few hours. Like sometimes there's like 20 people ahead of you, and you're probably not going to be seen for possibly a few hours. So, what is an extended hour clinic? So, extended hour clinics are similar to walk in clinics, and sometimes they promote themselves as a walk in clinic because they kind of are. They operate the same as a walk in clinic, except they have longer hours, usually earlier or later than other doctors' offices or other walk in clinics. There are very few extended hour clinics. Um, uh, Even in like Toronto. And for example, I just expect to drive up to like 30 minutes to an hour. And I will show you an example of how far away it is. For example, let's say you're searching for extended hour. Wow, okay, yeah. They call them primary care clinics, I guess, now. So as you can see, these close at 7 p.m., 8 p.m. There's a lot more now, compared to before, but there's still very little compared to regular walk-in clinics. Let's see, these ones, they open at 9, close at 8, like 12-hour shifts pretty much. Um, so yeah, see, like this one closes at 8. Well, let's, for example, you search walk-in clinics. And if let's say if I zoom in, there's a lot more compared to the after-hour clinics. And as you can see, these ones are all urgent care, but most of them close at 6, 5, 4, or even earlier. And then, yeah, like see this one, walk in 5 p.m. 6:30, that's on the later side. Um, but if compared to the ones I was showing before, that closes at 8 or 9. They sometimes don't really say their extended hour unless if you look at it and they say like 9 p.m. That's an extended hour clinic. Regular ones do not operate that late. Like this one says urgent care and it's 8 p.m. I don't know why it's not giving me stuff in the middle. Yeah, it's there's this big ravine, so there's not much stuff here, so it's gonna be on the left or on the right. So this one, 8 p.m., 7 p.m., 8, 6:30. Yeah, see, this one's 5 p.m. This is normally when walk-in clinics and doctor's offices close. Yeah, 6 p.m. And for example, let's say you're having an emergency at 12 a.m. At that point, you're just going to go to the hospital. So, and then this is where we have the importance slash necessity scale. Basically, depending on how important or serious the injury is, you can go to your family doctor, which can take up to a week or a month to get the appointment. Um, and Another option is the walk-in slash extended hours clinic, which you will be seen day of or within 1 to 2 days. Because if you go there too late, like let's say you go at 6 p.m. and there's like 30 people, usually you will get seen day of. But if let's say you get there at 9 p.m. and they close at 9 p.m., they might tell you to just come in tomorrow. um, and then let's say you have something that has like and you need emergency help right now, like at the hospital or in the emergency room, just go there instead. Like if it's a serious injury, um, and then you can see the scale of how long it might take for you to get to your appointment. And let's say the family doctor's office and the walk-in extended hours clinics, they're all closed. It's 11 p.m., it's 2 a.m. You can just go straight to the emergency room. Emergency hospital emergency department. The thing is, in the emergency department, if you have a lower priority or not a serious injury, it might take a while um, to actually see someone. If there's no one else, you just happen to be super lucky, I'd say you'd still have to wait like 30 minutes more or less just to go through the process of seeing the nurse, telling them what's going on, and then getting the help you need. So I would say 30 minutes, 45 minutes. But if, let's say, there's an emergency, there's a lot of people there, and you might not be able to see someone for 6 to 8 hours. If things get a little bit crazy and they just don't have the capacity to help you, you can still see someone. You're just going to have to wait a while. And in a sense, it'll also apply to the walk-in and extended hours clinics because there's no appointments. You just walk in. So that would highly depend on how many people are there that day and at that time. So it's common to wait 3, 4 hours, maybe even more, just to see a doctor at walk-in clinics, if there is a lot of people. And for example, if they have a lot of people, sometimes they might decide to say, oh, we're not going to accept patients after 8 p.m. if they're gonna close at 9 p.m. And that's why I said it's within 1 to 2 days. And then you go like, oh no, I'll come in tomorrow. And that's why I say with day of slash within 1 to 2 days. And I hope I cover most things. Um, and I think that's about it. Let me know if you like this kind of stuff, and I'll try and find more things to talk about because there's so much. I just need to kind of prioritize what I want to talk about and post, and hopefully this helps people. Thank you for watching and stuff.